Welcome to the Susan Brender Show. It's all about you. Featuring shows on health and wellness, the performing arts, politics, and people who inspire you to be your very best. And now, here's Susan Brender.
I'm Susan Brender, and this is the Susan Brender Show. Today I have a very interesting guest on my show. His name is Jonathan R. Berman. He's a doctor of plastic surgery, and he is going to tell us all about a subject we've never covered. Now, when I talk to him, the first thing I'm going to ask him is to define what is a plastic surgeon exactly?
What is a plastic surgeon? Well, plastic basically comes from the term malleable. And so plastic surgery is a field of medicine that really sprung up from the end of the First World War, when a lot of war injuries from the bombs and the shells had a lot of people that were tremendously disfigured, and to get them back into the world so they didn't look like gawks, reconstruction was performed to make people look better so they look presentable. There were all kinds of reconstructions that had happened before that for skin cancers to make wounds heal, but the plastic surgery that we understand today for facial reconstruction, cancer reconstruction, even the cosmetic surgery is all based upon the labors that took place in and around the First World War and moving forward. For example, the cleft lip repairs that we all do today were based upon one man's work that basically culminated in a lot of people trying to figure out how to repair cleft lips and palates. And most of that work was done by plastic surgeons that were working in and around Korea, where there was a little bit more of a higher percentage of kids that had cleft lips and palates. And American doctors were repairing cleft lips and palates in South Korea. Mm-hmm. So the wonderful field of plastic surgery is really a field of medicine whereby most people think it's just cosmetic surgery, making breasts bigger, faces tighter, noses more attractive. But how many people really know that we are really the champions of burns, hand surgery, all the tendon repairs, the microvascular work, to putting fingers back on when they get amputated? And I'm sure people have seen the news with face transplants, things like that. So the reconstructive portion of plastic surgery is where the cutting edge of what we do. Mm-hmm. But what people understand or see a lot of is a trickle-down, where it's mostly the cosmetic surgery where somebody whose eyes looks tired, or a woman's eyes look tired, so you go in and you get a makeover so your eyes look refreshed from a blepharoplasty procedure. Mm-hmm. Older people, they look tired and old, a lot of hanging skin, so they have a facelift. And gals do surgery for breast augmentation. Obviously, there's a lot of people who go and have liposuction, but those are more the glitzy cosmetic portions of one aspect of plastic surgery. And in South Florida, where we live, there's a lot of people that are having fillers done, like Restylane and Juvederm, to get rid of some of the lines, and even Botox to get some of the lines to go away, to make them look more rejuvenated. So the magical word of plastic surgery really takes on this auspices of cosmetic surgery, and most people think that, we're just beauticians making people prettier, but there's a whole lot of training, a whole lot of experience, there's a whole lot of knowledge, so we can hang a shingle out there that says we're board-certified plastic surgeons. So we do a lot of things, but for the most part, cleft lips and palates are being done by major centers. Mm-hmm. Craniofacial deformities, which is another facet where you work with neurosurgeons, because if the skull has got some changes that you have to release the bone so the brain can grow properly, people call plastic surgeons reconstructive surgeons to make that possible. Mm-hmm. Woman has breast cancer. They want to have the cancer removed, but they want beautiful, symmetric breasts like nothing happened. Mm-hmm. There's our forte.
Oh, there you go. Now, Dr. Berman, since you mentioned Juvenex and Botox and things of that nature, can you tell me a little bit more about the injectables? do many people use those injectables? For example, Botox seems to be a very, very, it's out there. Everybody seems to think that Botox is a great thing. But is it? Is it really a good thing?
Well, like everything that we do, there are people that had amazing results with what we can do. There are people that are very, very good candidates for the use of Botox. They're very good candidates for the people that will use fillers like Juvederm or the other high hyaluronic acids. What it really comes down to is when a patient comes in my office, and it's a question of judgment, as you certainly can imagine. Mm-hmm. I've been trained to think a certain way, to act a certain way, and you can certainly understand why when a patient comes in to see me, I look at them very differently than perhaps somebody who's going to a Medi-Spa who asks a nurse or who was ever injecting at a Medi-Spa what they would do to make them look better. Mm-hmm. Okay? So in terms of what I can recommend, I've got a whole armamentarium of things that I can do to try to make somebody look better. Mm-hmm. You know, it may sound really simple to just go to the very end to just get the injection, but, you know, who's doing the injection? Mm-hmm. What's the thinking behind the injection, and what's the safest thing for me to do? Companies like Allergan, who make the Botox, mm-hmm. they just want to sell. They want to do due diligence, and they give people certain little tasks and training to show that they're adequately and appropriately trained to inject a substance into somebody. But when it comes to judgment of how much to inject, where to inject, you know, that's part of the skill set which we have.
Right. Now,
so safety really comes down to who is doing your work.
Yeah. Now, that makes all the sense in the world. There's no question about it. But I want our audience to know a little bit more about Botox. It's a chemical, and it can be very, very strong, and it can be really dangerous. So tell our audience a little bit about Botox and whether they should be a candidate for it.
Well, Botox is really a botulinum toxin. You may have heard about a long time ago that if you had food that was kept a long time and you opened it up and canned food, you can get botulism and die from that. The botulism is created by bacteria as an end product, and it's a poison. And if you take a poison in a poison dose, you'll die from it, okay? Right. But what they've done with Botox is they purified it. They've also decreased the dosage of the botulinum toxin so that it can be used safely and efficaciously. In my practice, in my experience, I'm 56 years old. Mm-hmm. I've been injecting Botox since my 26th birthday for 30 years. Wow. Now, it hasn't been on the market for facial wrinkle improvement for more than 15, 20 years. But Botox is a very, very powerful agent that will put muscles to sleep. Mm-hmm. And what it was originally used for was there are people that had issues like what they call spastic dysphonia, when they talk like this because the muscles that fired to make you speak were, you know, vibrating so strongly that you would have a staccato type to their voice. So if you paralyze some of the voice muscles, you get a more even flow of the sound. Right. Same thing for something called blepharospasm. People have these constant twitching in their faces, and nobody knows what caused it, and the ophthalmologist would be injecting the Botox for the blepharospasm. Right. So this has been around for a very long time. Mm-hmm. But what you know about and the John Q. public knows about is Allergan has been selling Botox for cosmetic improvement for at least for the last 15 years. Right. It's a great product.
There you go.
But it's like everything else. One, who's doing your Botox injections, where they're being done, you know, what are the clinical indications, because I will share with you for the most part, Botox, I have to go back and look, and I'm missing on this one. Botox for facial irides or facial lines has only been approved maybe in 2 areas. A lot of it that we use it for is off the shelf for certain things. Mm-hmm. So, you know, it's safe, but correctly, it's wonderful, but incorrectly it isn't. I don't know if you remember, but a couple years ago, there was a veterinarian who was using Botox, and he paralyzed 2 people.
Yes.
How do you think he did that? He did that because the dosing isn't very good. And he didn't use, he used gray market Botox for that matter.
Oh, there you go.
So you always, it's like everything else in life, you get what you pay for.
You got it.
And I don't understand for the life of me how people compromise their health to save a buck.
Well, when it comes to money, people are very, very cautious. However, you're right. So many people, they learn about this because all of these spas, all of these people who call themselves sort of doctors, they advertise, and people are aware that Botox is not cheap. So it seems to me that the reason that they do that is because they don't understand. Now you're making them understand, and I really appreciate it, because our audience needs to know that if they're doing something like a Botox injection, it needs to be done by a professional who is a certified professional by the American Board of Plastic Surgeries, the American Society of Plastic Surgeons.
Now, before we go on, look, I'm not going to say we're the only people in town that can safely inject Botox. There are plenty of very, very capable people that are qualified, professional, that can do safe things. There are a lot of ophthalmologists. There are a lot of dermatologists. There are a lot of ENT surgeons, even certainly some oral surgeons, even some dentists. Look, the reality is, I'm not saying that we are the only game in town, because that would be a very haughty thing to say. I just think that if somebody's going to their internal medicine doctor to listen to their heart, and in the next conversation says, could you do my Botox for me? I kind of, you wouldn't want me managing your diabetes, would you? Or your blood pressure? So, I know when I was a little boy, we learned something, and when we went to buy, there's something called caveat emptor. Let the buyer beware. If you're going to see your internal medicine doctor for your heart problem, your blood pressure problem, for your stomach issues, that kind of makes sense, right?
Right. Yep.
Should he be the one be doing your cosmetic improvements? Right. You're not coming to me to manage your blood pressure. So little discretion is probably a smart thing.
Okay. Now, when people come to you, there must be a lot of questions that they should be asking you. Now, I'm going to give you just a couple of questions that I think they should be asking, and then I want you to just fill it out. So here we go. So many people need to ask you if you're certified by the American Board of Plastic Surgery, don't they?
I think that's an important thing, but, lots of us that are certified for those things, our diploma's right there,
Okay.
So, yeah, am I certified? Yes, my diploma's here. I have credible things, and there are different boards of certain credibility. Some are real boards, some are make-believe boards. Who certified you? I think the American Board of Plastic Surgery is a reasonable organization for that matter,
That's right. Now, another question that they should ask you, at least in my opinion, is how many procedures of this type have you performed?
I think that's a very reasonable question. But, you don't have to do 10,000 to be an expert in anything, I do think there has to be a certain number that you do, that you develop the skill set of what you're doing. And it's not so much also of what you're doing. You also have to know the downside of what you're doing and how to take care of some of the things that are the downsides. I think that's really vitally important, because there are plenty of people out there who are doing the injections like I'm doing. Even just give you an example. If you're injecting the Juvederm to fill up a line, but if you don't know where you're injecting the Juvederm and you accidentally inject the Juvederm into one of the arteries in your face, you're going to necrose that blood vessel, and you're also going to necrose or kill the feeding where that blood flow is supposed to be taken care of on that portion of the face. And trust me, if you go look at the literature now, you're going to see a lot of people that are not trained or board certified. Again, I don't want to say champion-only plastic surgeons, but people that are not as knowledgeable as perhaps somebody that knows the anatomy, that they have injected these by accident. Nobody's trying to inject the anterior facial artery, but if you inject the anterior facial artery when you are trying to inject Juvederm to make a nasolabial fold less prominent, you're going to necrose a nose tip. That's not very nice, because what ends up happening is, if you avoid the complication, you're likely not going to get it. But if you don't know that's a potential complication, you're going to get burned. I mean, it's the same answer where, would you go swimming in shark-infested waters?
Right. Right, I don't think so.
Okay, so where would you go swimming? You go someplace where you know there's no sharks.
Yep.
Well, you got to be careful.
Now, one of the risks and complications associated with most of these procedures, and I'm not talking specifically about people who have very horrible things going on in their face and other places, but I'm talking about the average person who comes into your practice and says, I want to be more beautiful, I want to look younger. What are the risks and complications? Can you tell our audience about that?
That's a great question, but it also depends on what you want to do, because you can understand certain things have more risk than others. Okay, if you're doing an operation, you're going to probably have a greater chance of some kind of downside than you are if you're just going to be doing an injection, right? So it depends what you want to take care of. I mean, I just mentioned to you about using a filler to try to make a wrinkle less noticeable. Okay, well, be careful where you inject your filler, because you don't want to put it into any tissue where you're going to potentially have a vascular accident, for that matter. Okay? If you use too much Botox in certain areas, you end up, one of the complications that you see, it happens, that if you're going to inject the 11s, which are the frown lines between the eyes, if you're not careful in your injection, some of that Botox may move down towards the eyelashes. You will then accidentally paralyze the muscle that makes you raise your eyelid, and you'll have ptosis, or inability to raise your eyelid for 3 months until the Botox goes away.
Oh, boy.
Now, it happens.
Yeah,
But you take precautions that if you know this is a potential risk of the injection that you're giving to make the 11s go away in your forehead, you do things to prevent you from, again, you don't swim in shark-infested waters. If you do, you're going to get bit.
Yeah, well, here's another thing that I think our audience ought to know is when there are complications, and I'm sure even though you're experienced, sometimes that happens. So how are complications handled? What do you do? I mean...
Depends what the complication is.
All right, so
okay.
you talked about deadening the muscle around the where you put in the Botox. What happens if there are complications? Well,
Botox, for example, the complications. Okay, if you inject Botox, here's a great example. I have a gal who I've been injecting to get rid of her crow's feet, which is those little lines at the side of the eye, and she tells me that it's like little starburst patterns, right? It's like little rays of sunshine. Okay, and she said, I really would like you to get rid of the line that's a little bit lower. Can you use the Botox to make that go away? I says, well, here's the thing. If I inject in that area, there's a possibility, there's a muscle there that controls the corner of your mouth. And if that muscle, additionally gets rid of, if I inject that area and I make that little ray of sunshine go away, so you don't longer have that smile line that you don't like, but there's a possibility that if I get that little portion of the muscle, you're going to lose the ability to smile in that corner of your mouth for 3 months. Is it worth it for you to do that? She says, well, you're not going to do that. Let's take a chance. So I told her ahead of time. We did the injection, and unfortunately, just what I told her would happen, that because we were getting into the territory where that other muscle is, I put that muscle to sleep for 3 months. She comes back a week later, says, you were right, I shouldn't have done it. What can you do? She says, well, massage the area, increase the blood flow. You're probably going to get, the muscle's going to come back. I just can't tell you it's going to be 2 months to 3 months, but it's going to be a gradual improvement. And that's the other thing with Botox. The muscle all of a sudden just doesn't go to sleep, and then all of a sudden just wake up. It's a gradual sleepy process, and then there is a reawakening process. So the manufacturer says Botox is going to last 3 months. It doesn't last 90 days. Maybe it'll last from day 79, you're going to start seeing some improvement of that muscle, and by 90 days, it's going to be back to normal.
Wow,
so, one, you try to avoid your complication from occurring. If you do get that, the nice thing about Botox, which is really very nice in this regard, it's going to be gone in 3 months. So, thankfully, the drug is a drug, and drugs have half-lives and expectancy and times, and, that's what happens with the Botox.
Yeah. Okay, so I asked you before, I said some of the questions that people who come to you should be asking. I gave you a couple of questions. Now, what would you like your patients who come in, what would you like them to ask you?
Well, they can ask me almost anything within reason. And that's basically it. I think one of the things we pride ourselves in my practice is we like to educate our patients, because we figure if we educate our patients, they can become knowledgeable about what we're doing or what we're trying to help them with. Then they ask better questions, and they also have a much better understanding of what I can offer them and what I can do for them.
Well, take me through the process for a moment, Dr. Berman, because say, for instance, I walk into your office and I say, I'm just so unhappy with the way I look. I mean, I've turned 60 and everything seems to be going down. So I want to do something about it, Dr. Berman. So what should I, take me through the process. What would you say to me?
First thing I would do is, what is your health like? Do you have any medical problems? Do you have diabetes? Do you have a high blood pressure? Do you have a heart attack? Did you heart in good shape? Do you have a history of cancer? First thing is always, you got to get a general idea of the overall health of a patient. For example, maybe you're a candidate for a facelift, let's just say. Maybe you're not. But if you had a massive heart attack 6 months ago, I can understand you feeling a little bit down and out because you have health issues that are precluding you from feeling your normal self. Mm-hmm. And because you had a heart attack 6 months ago, you're probably not a candidate to have any surgery, right? Okay, so that's a whole different gal than the gal who comes in who's 60, she works out, she's keeping herself as fit as she can. She says, Doc, I'm trying my damnedest, but I can't make the signs of aging going away. What do you do? Mm-hmm. So you got to know the demeanor of the patient. You got to understand what they want, and you got to listen.
Very important, I'm sure.
Listening is a very, I pontificate maybe a little bit too much. It's my nature, my style. But I really have tried very, very hard to listen to what my patients are asking me. Mm-hmm. And if I understand what they're asking me, I can answer their questions. So if you come in, Doc, what can you do for me? So what I will do is I'll listen to what their wants are. I'll take a little bit of a history from them so I understand what their state of mind is and state of health, general health. Then what I do is I sit the patient down in front of my big mirror. Mm-hmm. I said, this is your best friend and worst enemy. Here's you. Look in the mirror. What bothers you? What do you see? And I always say, well, tell me the things that you like first. Tell me what you like, then tell me what you don't like.
So now, how does a facelift, without doing it, how do you make it look like it's not so tight? I see so many of the women around, and even men, who've had facelifts, and you see their lips are kind of full, the faces are very tight, their eyes are extremely tight. What do you do about that?
That's the art of what I do. The magic is finesse, experience, skill set, talent. Best example. Do you like Italian food?
Oh, you better believe it.
Aren't there 15 or 20 Italian restaurants you can go to? Mm-hmm. Do you go to every one of them and have the same experience of each one you go to?
Absolutely not.
Do some make a better red sauce than others?
Without a doubt.
And aren't some restaurants that make a great red sauce? Mm-hmm. They have a great maitre d'. They have a beautiful ambiance. The help is terrific. And when you go to that restaurant, you have an amazing experience versus going to some other place, right?
Right, of course.
So you end up going, of those 15 restaurants, you go to 2 or 3 that you think are just superb. Mm-hmm. Welcome to what I do.
There you go.
When we train, there's no question we learn the nuts and bolts. We learn the anatomy of what to do, how to put things together and what to take apart, and how to rebuild. But once we've learned, now is the practice of medicine. How do we do it better than the guy next door? What's our aesthetic versus his aesthetic or her aesthetic? What kind of complication rate do we have? How do our patients heal? Whatsoever. That's the best example I can give you. And it's just one of those things which takes time to develop, because your favorite Italian restaurant didn't become your favorite Italian restaurant because he just opened his shop, you went in there and you found it great. He probably, or she, he's been there a little bit of time. You went there once, it was probably pretty good. Then you went back, it got better. And it kind of builds on itself, doesn't it? That's the game. So there's a finesse in anything you do that makes this place better than somebody else. You may proclaim you're great, okay? But in the end all, my practice, mostly word of mouth, my results they can see on the website of my befores and afters, my experience. Those are very, very important things. And how my staff educates them, listens. I tell my staff every day, you got to listen to what the patient wants. Mm-hmm. Then we can deliver the quality product, which I know we do.
Yeah. Now, let's be a little more specific. So somebody comes in for surgery. How long is the recovery for a full face surgery?
Again, I'm not trying to avoid your question, but if you're just doing a facelift and you're not doing anything else in addition to the facelift, typically the person is going to be taking it easy for a good 5 to 10 days. I let them go back to work maybe 10 days after their surgery. They're going to be a little swollen. The sutures still have to heal a little bit. They'll be able to go back and doing desk job type stuff between 10 and 14 days after their surgery. I'm not going to let them play baseball. I'm not going to let them play tennis. I'm not going to let them play golf. I'm not going to let them go swimming. I'm going to minimize the amount of movement of that head, right or left, up and down. Think about it. If you want to play tennis, you got to run around a little bit, right? You have to focus and you have to strain your neck a little bit. Mm-hmm. Golf, as much as people don't think it's a very active sport, but you got to keep your head down, hit the golf ball. Mm-hmm. Swimming, as you breathe, you go back and forth with your head. So I'm going to tell people to lay off their physical activity for a good month.
There you go. Now, I had some questions from some people I spoke to, and one of the questions that this woman wanted to ask you is, what do you do about crepeness on your chest?
Depends how bad the crepeness is. But one of the things we do have in our armamentarium, you're not going to do a chest lift. You're not going to cut on that. But there's different lasers that we can use to help tighten the skin and make it look better. There's lasers like there are lasers that are skin tightening lasers, one, and there's also something called intense pulse light, which is a whole spectrum of light that you hit at certain frequencies on that area, like the décolletage, the upper chest. It takes care of the brown spots and the red spots, and it will tighten some of the skin as well.
Now, here is another thing that I'm very interested in. Where does stem cell, where does it apply to what you do?
Great question. I don't have an answer for that yet. There are all kinds of people who are claiming this great thing. There's one technique where they go harvest blood, they mix it up with some stem cells, and inject it back in the face. Our society has poo-pooed that. They don't think very much about it. Nobody really knows yet, okay? Typically, the fat has a large predominant, if you harvest fat, there's a large number of stem cells that are in there, okay? And there was a time when you used to take that fat, you used to inject it into the face, and instead of, we used to call that maybe a fat transfer, you'd say there's a stem cell transfer. But it's like, our society says, poo-poo, that's not real. So it's still out there, because even if you go to the orthopedic literature, a lot of stem cells are being done. And PRP, the platelet-rich protein, you're going to get anecdotal things where some say it works, some say it doesn't work. Okay? So I don't think anybody really knows the answer of what stem cells are going to do yet.
But you do think there's promise with it?
I'm not going to say yes. I don't say no. I don't know. Just because somebody thinks it's the latest and greatest. I like to do things based upon science, where there's a lot of literature to back up, because that's the scientific methodology in which we do all our things.
So you're saying that evidence-based medicine is the most important thing to you? I
think it's very important. Is it the most important thing to me? Again, who's doing the studies? Who's paying for the studies? If the drug company is making the stem cells, are you going to believe them versus an independent contractor who's doing the work himself? If the guys who are manufacturing a device to deliver stem cells, are you really going to believe his results? Because he's trying to show you that, that works. So you have to be very careful when you look at an experiment or literature, who's paying for the literature and who did the literature. Yeah. And it's become very, very cloudy these days, where best example is when we deal with laser companies. Every year there's a new laser that's better than the year before. And you go look, and you look who's written the article about it, and it's like, Stephen Smith. He's on the payroll from the company who owns the laser.
Right.
Well, what do you think? You're going to take that as that's a really good clinical study, or this is a study which there's a certain bias of the investigator of what he's trying to solve? So, like everything else, if you watch television and you put on CNN and you put on Fox, would you tend to agree with me that CNN is a kind of a a liberal slant on things, and Fox may be a little bit conservative?
Well, I know a little bit about television. I've been in that field. But, yeah, you're absolutely right. I mean, there are certain stations that are more liberal than others. But, okay, let's move on for a minute. Now, there are so many new products out there that have been developed, and the consumer is just inundated with all of these things. Now, for example, there's something called second skin, and I want you to talk about that, because that might be, I hate to say it, but it could be your competitor. I mean, if second skin worked, then...
Well, there's been a lot of products over the years where they've championed something called second skin. I'm not sure which one you're talking about.
I'm talking about anyone. I mean, just the whole notion. I mean, a lot of, shall I say, a lot of celebrities, they promote these, quote, second skin. Tell our audience about second skin. I mean, it's is it a cream? What is it?
I don't really know enough about which one you're asking me about, okay? I know I've seen at least 4 products in the last 3 years that were called second skin, and I'm not trying to avoid your question, but I'm not really sure.
So you don't promote any particular medicine or any particular cream, do you? Or do you promote something? Do you give your patients some of that stuff? Well,
in terms of this stuff, I use a product line in my office that has been created by a company called Obagi and another company called PCA. And in my experience in private practice, I've seen a lot of companies that manufacture stuff that I like and stuff I don't like. Mm-hmm. A lot of the stuff that I use has been family tested. I have a beautiful wife. I've got 2 daughters. Mm-hmm. I get the samples at the meetings. I bring it home, and I read the ingredients. Hey, the ingredients seem pretty good. I give it to my wife. Honey, what do you think of this stuff? Mm-hmm. Oh, it's pretty nice. Give it to one of my daughters. What do you think? I like it. I said, okay, well, I've got 2 biased opinions where I can get anything I want. Mm-hmm. I can push anything I want. And basically, what it comes down to, it's a little bit empiric. I try different things. Mm-hmm. We don't always stick with the same things that we have. Some doctors have, made their own skincare lines or got involved with that to do that. I really haven't done that yet. But there's a lot of good products out there. There's certain things that all the good products have certain things in them. Mm-hmm. And
what are those things, Dr. Berman?
Usually they have some kind of, wow, now you're making me tax my brain. I have to go pull one of them and see. Okay. But basically, one of the things would be there's usually like an acid in terms of like ascorbic acid or what was it? Glycolic. That's the word. There were some glycolics. Some of them have some retin A products in them. They oftentimes will have a bleaching product in them, like a hydroquinone. And all the quality products that I end up seeing, or the lines, they have some kind of astringent which cleans the skin well, something that's got something in it that has some kind of glycolic, like I stated. There's usually a retin A program that goes along with it, and I'm blocking on something else, but there's usually, and the bleaching cream, something that's a hydroquinone that kind of to lighten the color. Those 3 are usually the ones that most quality products lines have those things in them.
Mm-hmm. Yeah. So now, I guess the next question has to do with facials. There are many people who go to spas, and they have facials there. Do you believe that facials are also a good thing for the skin?
Sure. Mm-hmm. Yeah, they're terrific. Okay. I think you have to clean your face. Mm-hmm. And some of these facials, just like you're talking about, the potions that you put on the face, and have been around since the days before the Egyptians, okay? And women through the ages always want to look young and beautiful. Things have not changed across the decades, the eons of time. And some products are phenomenal, some products are not so phenomenal. And some products have, the things I just mentioned to you, have this versus that, et cetera. Mm-hmm.
Right. Now, predisposition to having wrinkly skin, skin that sags, skin that just doesn't look good, is it because of genetics?
Oh, that's a wonderful question, but nobody knows the answer to that. I'm sure genetics plays a very big role in that, as does environment, meaning that if you live in South Florida and you're always out in the sun, you got a lot of ultraviolet, so that's going to be an issue with that. How much of your time is being spent outside? What do you eat? Oh, my God, it's a multifactorial answer. It's not like there's one thing. You know, I'm sure you have friends that have absolutely magnificent skin, and they do absolutely nothing for it.
Right.
And you have friends who do everything on the planet to make their skin look better, but it doesn't help. I'm sure you have friends who smoke cigarettes, and their skin looks awful. And you have the other friends who smoke cigarettes, and their skin looks great. So in terms of genetics, in terms of hereditary and things like that, you know, it's important. You know, that's where it's at.
Yeah. I'm sure that's the case because I see so many women and so many men who they could be in their 60s, 70s, and 80s, and they look like they're in their 50s. And then you see others that are in their 50s, and they look like they're in their 80s. So, you know, you got to question what is the reason for that. But
well, it's no different than when you go to the market to buy food. Now, if you go to the market to buy food, you see all these stores of whole food, from farm to table, Greenwise, all these different kind of venues to buy food. People go into those stores because they believe it's healthier to buy table, like a farm to table type products, organic things versus the processed stuff. Now, if you go look at the medical literature, it's not really there to say that you're going to live longer if you eat Greenwise food than eating normal Publix food. It's never been shown, but some people really believe that if they stay on that kind of diet and do that kind of thing, they're going to live to be 100. There's a lot of things we don't know answers to, and you can't tell me that that person who is eating the high-fiber diet or this thing, that they're wrong, because we don't have enough information. You've seen diet fads go in and out.
Yeah. That reminds me, do you think that when people, if they want to kind of stay young and be, stay beautiful in their own way. I mean, everybody, beauty is right in the inside, not on the outside. But if they care to be healthy and have good skin, you must know a little bit more about the things that they should do for their nutrition, for good nutrition. There must be something.
Yeah, well, I think that's true, but also doesn't stress make a lot in terms of what people look like and how they respond to things? I mean, if you've got a very stressful job, you're probably going to look a lot different than somebody who's got no stress. So there's a lot of untenable things, but in terms of nutrition, obviously you have to eat a certain amount of fat, you have to eat a certain amount of carbohydrates, you have to eat a certain amount of protein, a certain amount of vegetables, and I don't have a magic formula to that. Do you?
Well, no, of course not. But on the other hand, many doctors don't seem to study about good nutrition. But, it's changing. It's changing because people know that there are certain things in their diet that they should have. Don't you agree?
That's a ridiculous question because it's a rhetorical question. I shouldn't say ridiculous, of course.
Right. I
don't know what the answers are. I do know that if you don't eat certain things, you're going to have problems.
Okay, so what are those things?
Well, come on. If you don't eat enough vitamin C, you're going to get scurvy, right? That's what happened to the sailors way back when they didn't have oranges and grapefruits and limes on the boats, right? Pellagra, if you don't eat thiamine, there's, I may be missing with that one. I don't remember per se, but there's certain things whereby in our modern culture, in our modern world, you're hoping that you're eating a much better balanced diet because everything's out there for you to get, but I don't believe if you have fast food every single day, 3 days a week, that's as healthy as if you don't have fast food every single day.
Yeah. Well, of course, our audience knows about that, and if they don't, they're making a big mistake. Now, last but not least, I want you to tell our audience about what you think is the thing that they should do if they want to have plastic surgery. Should they research the doctor? Should they take a look at all the things that he did on different people? I mean, give our audience a little bit of the to-dos, if you will.
It's a very good question, and I'll be as succinct with the answer as I can. I think what's very important is to decide what you want to get done, then try to find yourself a doctor that does the things that you want to get done. For example, if you're looking around for a plastic surgeon and most of the stuff that you seem to hear that he does is breast reconstruction and you want to something on your face, you may think twice about going to the guy who only does breast surgery, where maybe you should go to a guy whose focus is mostly on the face. Mm-hmm. That makes sense, right?
Sure does. All
right, so that's statement number one. Statement number two, I guess what I think is probably a good idea is nowadays, when I was younger, the Yellow Pages used to be a pretty good reference source to find things, because if you wanted something, you would go look up something in the Yellow Pages, and anybody who advertised in the Yellow Pages, you know that people had very big ads and somebody would have single line ads, and you would make a decision by, if he only has a single line there, he's not making a lot of money, he doesn't want to be advertising this thing, so maybe I'm not going to call him. But, man, this guy's got a 2-page ad? Mm-hmm. And then you say, wow, I don't really want to go to a guy that's got a 2-page ad, because obviously, that's it, he's advertising big time. Mm-hmm. So you got to fix. So nowadays we have something called the internet, and if you go Google something, you're going to get a lot of information on that page, and now you start sifting around for what you want. Mm-hmm. And people know that at the top of the Google there's paid ads. Mm-hmm. Along the right-hand side are paid ads. And the reality is now you start looking, okay, now you're breaking it down. Do I want to go to somebody that spent a lot of money to pay to be at the very top or on the sides, or I want somebody who's more of an organic, whereby, this is the stuff I'm looking for in the website. So now let's just, whatever website you end up, so I would say, one, maybe go to their website. Take a look at the website, because everybody's website is usually pretty good. Some are definitely more outstanding than others. You can read about the doctor. Almost everyone will have a little blurb or something that the doctor wants you to read about them so you have an idea of who they are. I think that's helpful. I think it's very helpful to get an idea, how long has this guy been in practice? Is this a rookie? Or has he been in practice a while? Because a rookie's, we all have to start somewhere, but I don't think anybody who's in their 50s who wants a facelift is going to go to a guy who's just opened his shop a week ago.
Right, of course.
I wouldn't recommend that. Mm-hmm. And I think you get better with these procedures the more you do. So experience, I think, takes a very dear school. The next thing I would think has something to do with it is you look at their before and after pictures. Because after all, there's his showman. It's like if you want to go to an artist, mm-hmm. don't you want to look at the paintings? And if you have to decide if you like a Renoir or you like Picasso, and you're going to determine by looking at some of these people before and after, it says, yeah, I like the kind of results. I see the kind of patients he's operating on. And he's doing a good job. And you start thinking to yourself, what do I look like? Mm-hmm. Do I look like that person? Can I get that kind of result? So, there's something like that. Mm-hmm. That's important. And I also think what's as important is there's location. Where's the doctor's office? I think you're going to think differently about a guy who's got an office in East Podunk versus a guy that's on Park Avenue.
Well, of course. But that might be an illusion, though, because sometimes there are doctors, even if they're in Podunk or they're on Fifth Avenue or Park Avenue, sometimes it's just an illusion because they seem to be able to pay for that. And
well, how are they paying for it, though?
Well, obviously they have a lot of patients, right?
Well, how come they have a lot of patients?
Well, you answer that for me. What do you think?
I think there's a comment. You asked me how you choose. So there's a whole lot of different choices of what people do. But there is something to be said that if you're going to go buy a home, there's certain areas which are more outstanding than others. Mm-hmm. Okay? And you got to make a choice of what's important to you and what you're looking for. And certainly somebody who has a home that's in a higher rent district, why is that home in a higher rent district? What does that home have to offer that the other home didn't? I'm not saying it's right for everybody, but you asked me certain criteria, mm-hmm. and I think that if you go to somebody who's, like I said, guy's office is in East Podunk, right, versus somebody who's on Park Avenue, well, yeah, the guy on Park Avenue is paying a lot of money for his rent, but you know what? That means he must have a lot of patients to be, a lot of people that are seeing him, mm-hmm. that he's able to keep that address. You're going to feel more comfortable and one of the other things is when you go to meet the physician, which is obviously important, is he confident in what he's doing? Do you like the guy? Can you see him doing the things that you want him to do? Does he listen? Does he communicate well? Because the next important question is, you're not looking at him because he's going to be your friend. Mm-hmm. You're looking at the guy or gal. Can they hear what you're asking them to do? Mm-hmm. You've seen the work that they're able to take care of. Can he give you the result that you're looking for?
That makes a lot of sense. Well, we only have a couple of seconds left, so if people want to find you, how do they do that? Do you have a website? How do they get to you?
We have a website, and it's drberman.com, www.drberman.com. They can go to the website. There is a plethora of information on it. We have an area of not just about our surgeries, but an area of a blog area where we answer all kinds of questions, and I think there's probably close to 150 articles that we have brought to people's attention that we blogged about.
Wonderful.
And there's before and after pictures, and for those that don't see information that they were looking for, there's certainly an informational area where you can fill out a contact form. You can ask me a question, and we'll come to us, and we can respond to it.
Mm-hmm. Well, that's great. And if our audience also wants to get a consultation with you, is that something that they can do?
Sure, they can pick up the phone, give us a phone call and set up a consultation. I have found over the years that that's really the best way to handle things, because I think it's important to meet your doctor, understand your doctor, and see if they can understand what you want them to do for you, because you may have unrealistic expectations of what you want to try to get done, and it's a really good idea to find out what you want to get done before you have it done to get a result that you don't like, because then you and the doctor are both unhappy.
Well, today my guest has been Dr. Berman. Now, I want you to know, everybody in the audience, that Dr. Berman is a very, very good surgeon. And I don't say that from experience, but just listening to him makes me understand what kinds of questions
That's very kind of you
we should all have. Oh, it's my pleasure. I want to thank you for being on the Susan Brender Show, Dr. Berman. It's been a pleasure.
I've enjoyed it as well. Thank you.
Thank you for listening to the Susan Brender Show. To be a guest, email sebrender@yahoo.com.